Once we'd established our first clinic in the village of Andavadok, it became very clear, very rapidly, that the family planning unmet need was the same throughout the entire region that we were operating. And we felt immense pressure to scale up our intervention, so we served the entire community that we partnered with. And over the subsequent 3 to 4 years, we worked really hard to replicate this service in all of the villages. So we started with one clinic in one village, and now we have a multi-site service covering all 40 villages that we partner with for our community-based conservation work. So now we have an integrated population health and environment program for all 40 villages. We have a variety of models of service delivery. We have outreach clinics, so we travel from village to village by boat. There are no roads. We travel by boat to different villages to run our outreach clinics. We also have a program of community-based distribution where we have community representatives who are trained to distribute contraceptives, operating to closely monitored clinical protocols. And in addition to that, we partner with Marriage Therapy International, who come and offer long-acting and permanent methods of contraception as an outreach service. So that's the kind of model of service delivery. So now we've developed a service where it's truly integrated. We think we've developed a model that works very well, and the integration enables us to create synergies. That means we're more effective at achieving both health and conservation goals. And it really adds value to each individual project. Let me give you an example of some of the ways integration works. So the majority of our education and messaging delivers an integrated message. And so when we run a meeting with the community, our meetings include messages about family planning. They include messages about hygiene. They include messages about fisheries. They include messages about alternative livelihoods. And as a result, we get broader reach. We get broader reach of our messaging, and we get wider audiences. So now, women who come to hear about family planning get to hear about fisheries. Men who came to hear about fisheries management get to hear about family planning technologies, perhaps for the first time in their lives, which is great. In addition to that, we're getting greater buy-in from the community because they all see the added value of the breadth of things that we offer them. To give you one example of how we integrate our messages, we had T-shirts made, and these T-shirts were made these T-shirts that we had made were designed by community members. And remember, these are fishermen that we're working with. And the T-shirt strapline says, if we have too many children, there won't be enough fish. So these are fishermen who see those links between food security and population growth themselves. They don't need us to tell them that message, and they're integrating it, and we're doing that for them through the work that we do. So what we've learnt is this model works, and we believe very passionately this model can be scaled. We believe very passionately this model can be taken to scale. I don't really believe there's anything magic about what we've managed to do. It's felt like, yes, this is something that could easily be replicated in other regions, definitely in other coastal regions, but almost certainly in other remote areas, perhaps areas of high biodiversity, with our existing projects, perhaps conservation projects, but where there's an unmet need for healthcare and family planning in particular. And my advice to other organisations, whether you're doing healthcare or whether you're doing conservation, is just think holistically. Think in an integrated way. If you're a conservation organisation that recognise that there's an unmet healthcare need for the communities that you work with, then don't be frightened to ask those questions. Don't be frightened to engage with your communities on issues relating to reproductive health or issues relating to health directly. Don't be afraid to ask those questions. And don't be afraid to build capacity to meet the need if you find one. Or don't be afraid to partner with health NGOs to enable that need to be met.